Welcome to the 2013 Employee Benefit Survey for the research consulting industry. My name is Michael Graham, and I'm a consultant with Grahall. One of the first things to talk about is really who was in the survey. And as you see in the page 5 of the actual report, you see a whole list of organizations. But just seeing the names of organizations isn't really enough to understand who they were. So here's what we've got. The first thing is, a question we've displayed for you is, how many employees do you have who are eligible for example, medical coverage or benefits in general? And this really indicates the size of the organizations. Obviously, there were some relatively small organizations in the process. Less than 100 employees, for example, or between 100 employees and 500 employees. That made up about 31% of the population. And then you had organizations, about a third of the population of individual companies in this particular survey were really between 500 and 1,000, reasonably good-sized organizations. And then you had 21% of the organizations were between 1,000 and 2,500, so obviously that's another really good population of people. And then about 16% of the organizations were larger than 2,500 people or later. So what we're seeing is a very large, nice sample of organizations when it comes to participation in the survey, and that should give us a lot of insight into the types of changes that are being made for these organizations. Well, what types of employees do you all employ? And one of the ways to think about that is, what's the average salary for the employees? In this case, you see really that the highest number of organizations said that their salaries really range between $50,000 and $100,000. And I think the actual average of the survey was $89,000. So these are relatively well-paid individuals. Obviously, they're researchers, they're professionals, and so we get a picture of clearly what the kind of participants that you each have. One of the clear issues is, of those individuals, who's eligible for the benefits? Well, in this case, we asked the question of, how do you determine full-time status for benefits? In this case, a lot of you said that it was 40 hours or more. And in fact, about 53% of you said you have to be here 40 hours or more. 26% actually require at least 30 hours, and you'll see obviously 10% require at least 35 hours. So surprisingly enough, there was a fairly good-sized range of different policies when it came to who was actually eligible for full-time benefits. Well, for part-time benefits, we also saw a pretty significant range, although the central policy is about 42% say that at least 20 hours. So that's pretty typical. That's what we would have expected. What we didn't really expect is the entire range of alternative ways of thinking about eligibility for part-time. In terms of the current program, we asked you to indicate which programs below you're using today and what plans you have for the future. And what we see is that a lot of organizations have a very wide range of programs, and what we also see is that a pretty good-sized number are continuing as is, but also a pretty good-sized number are actually redesigning programs. A lot of organizations don't have and don't plan to adopt certain types of plans, and that was great for us. It really made us understand the landscape. In addition, there was a question asked which said, of the plans you do have, what plans are you terminating? Well, only in one case, about 5% of the companies, in this case obviously since there are about 20 companies, only one company indicated that it was thinking about terminating its medical HMO. But redesign obviously is a little bit higher, not quite as high as we would have expected, but about 21% of you are thinking about redesigning your medical PPOs, about 16% thinking about redesigning the medical HMOs. And then continuing as is, right now I guess most of you would suggest that you're thinking about continuing as is when it comes to these types of medical and dental and vision and of plans. One of the things we really wanted to know is, in the medical area, is what types of plans were offered by employers and what were the actual corresponding employee enrollment. Well, you can see that the majority of employees really enrolled either in the PPO or HMO plans, and a much smaller degree operated in the POS and high deductibility or indemnity plans. So those plans really have lost a lot of their sheen and probably are going to be not as useful as the plans which as they were in the past. Well, we asked also in medical, what is the annual in-network deductible under the plan with the highest enrollment? And about 43% of you said that the annual in-network deductibles was 0. And then what you see is a real range around what people have for in-network deductibles for the family or the individual. And you see from $100 to $200 for the family, all the way up to $1,500 for the individual and over $3,000 for the family. Very interesting information. Please indicate also the out-of-network co-insurance. Co-insurance generally, as you can see, for this type of issue is between 70 and 80%. And that seems to be pretty common, regardless of whether you're talking about hospital surgical, different types of illness, urgent or emergency room types of care. Well, let's talk about something that's also pretty critical, the out-of-pocket maximums for out-of-network. What you see is two numbers, both for the individual and for the family, and you see clearly that most organizations do not have an out-of-pocket maximum for out-of-network, or the out-of-pocket maximum is 0. Then you see an entire range going from $1,000 to $18,000, depending upon whether you're individuals or family. This is pretty remarkable. This means that while there's a consensus about not having one or not being applicable, there's a wide range about the applicability of this out-of-pocket maximum for out-of-network types of issues. Well, one of the things that's also very critical to employees, which is also pretty visible, is the in-network primary care physician visits under the plan. So what we look at there is, we asked what was the copay for in-network primary care physicians under the plan with the highest enrollment. And this, you look and see that 44% say that the copays are really about $20, but 33% $25, and 11% say $30. So you really got between $20 and $30 for the in-network primary care physician copays. Well, let's talk about the copays for in-network office specialist visits under the plan. We asked what the specialist copay was. You begin to see a little bit more range here. So about 12% have $20, but about 6% have $150 for the specialist. That's a pretty good sized range, with obviously the central tendency with about a third of you having between $30 and another 24% having $35. So as you see, for the in-network office specialist visits, the type of copay can really vary quite substantially. Emergency room copays. Well, it seems to us that most of you out there have coalesced around a certain number. That certain number is $100. Yeah, there are some folks who've got $75. There's some people who have got $150, and even some people who have got $1,000. But in fact, what we're talking about here is that generally speaking, about 40% of the organizations that responded to the survey say that the copay for in-network for the emergency room visits is really about $100, which seems pretty typical. Well, what about copays for in-network urgent care under the plan? Okay, so what we see here again is that there's a central tendency to say, well, $50 seems about right to us. But in this case also, you've got people with nothing and you've got people with $200. That's a lot of design freedom for most people. That's also a pretty big difference for most employees. If you come in for $50 and someone across the street says, well, my in-network urgent care is really $200, that's obviously a big difference for a lot of employees. There's clearly a lot of design freedom here. Well, what about prescription drug coverage? About 80% or 79% of you have copays only plans. 21% of you have really a separate deductible and a separate co-insurance plan. We also want to know what plan features does your prescription drug program offer? Well, a lot of organizations say, yes, we've got mail order types of coverage. We've also got formulary types of coverage. And we've also, fewer of them say, well, we've got biotech. Almost 60% say, no, we don't cover the types of basic drug plan prescription drug program offers. Well, what about retail prescription drug benefit copays? Well, copays have, as you can see, a range for retail types of copays. They go from all the way over here to $5 and all the way over to $120, certainly depending upon whether it's generic, preferred, non-preferred, or biotech. So here's an area where there's not much agreement in terms of the types of policies you have. So we would argue there's probably been a lot of design freedom in this particular area. Well, mail order, my gosh. Mail order co-pays, they reflect programs with mail orders only. Now, this means that only those organizations that have mail order programs for reimbursement. And again, you can see that the range goes from $10 to $150, and it also ranges based upon whether it's generic or non-biotech. Obviously, the non-preferred, organizations tend to have a lot higher copay for those because we're all trying to discourage the use of those types of programs. And you can see that the preferred drugs have, I would say, more in the middle, although it goes clearly from $20 all the way up to $100, which is a pretty significant range. But the generics, you can see, generally speaking, are between $0 and, well, there's a few companies up in here with a $50 and $70. But generally speaking, that's the lower. And that's what we would have expected to see. Well, let's talk about dental. We asked you folks to rank the dental plans by order of employee enrollment. And you can see that the traditional plans have relatively small numbers of enrollment, and you can see that the preferred provider plans have really taken over the marketplace. And you can see that the dental HMOs have been up there. And this could be those plans that you offer, and these is obviously the plans that are the most prevalent. Well, one of the big issues in the major dental plans. Well, as we can see, about 56% of the organizations have about $1,500 as the annual maximum. And that's about what we would have expected. But there's also organizations that have more. About 70% have $2,000, and about 11% have $1,200 maximums. In this case, one of the things we wanted to look at, which is a pretty big issue for the future for all of us, is the health care plan design for retirees, and whether or not organizations are going to continue to offer retiree coverage. Well, in this case, we wanted to know how organizations determine the eligibility for retiree benefits. In this case, we looked at the eligibility is based upon age and service combined, which shows about 80% for those under 65. For those over 65, about 60%. That's what we would have expected. In addition, of course, we've got organizations where all employees are eligible, whether or not they've met basic age or service requirements. And then, of course, we've got a certain number, about 20%, who do not have coverage for over age 65 folks for medical benefits. If you use a formula for determining retiree eligibility, we asked, what is the formula? Well, it's kind of fun. Look at, we have four most significant types: age 55 with 10 years of service, or age 60 with 5 years of service, age 45 with 15 years of service, or any age with 25 years of service, age 55 with 10 years of service if you meet some additional requirements, age 60 with 10 years of service, you may be able to continue your coverage to age 65. So lots of different choices. Well, let's talk a little bit more about retirees. What types of medical plans are the types of plans that are offered to employees? Well, what you have here at age 65, what you see is a lot of plans, a lot of organizations offer a supplement plan, or about 50% of the plans. PPO plans and HMO plans. You can see the vast majority of plans that are offered to retirees are really on this end of the spectrum, with the POS or PPO plans or the HMO plans. And what you can also see based upon the color coding is that certain plans are offered for those folks under age 65, certain plans for people at age 65 or greater, certain prevalences for before 65, or certain prevalence after 65. Well, at the core of a lot of the questions are, what have been the historical increases for organizations when it comes to the cost of the health care benefits program? Here, what we've done is we've arrayed the benefit increases for each of the years 2010, 2011, 2012, and 2013. And we've plotted, as you can see, those lucky organizations that had either a decrease or no change, all the way up to those who had an increase that really moved up to 10 to 15%, or the very unfortunate people who had an increase that was actually greater than 15%. And as you can see, those folks who had the greater than 15% probably have been in the minority, but also there's been some people in the 2013 year, about I would say 33% of them have actually experienced a decrease or no charge. You can see that a lot of organizations in the last few years have had increases of between 5 and 10 and between 10 and 15%. There's a lot of different experiences out there when it comes to the premium increases for the last 4 years. Now, what changes, if any, have you passed on to your employees in relation to those changes in the cost of the program? Well, as you can see, about 50% of the organizations have actually increased both the contributions and the what we call the OOP costs. They've also, in many cases, changed the types of plans. So what we asked is about 50% of the organizations have changed or made changes in at least 2 or more types of increases that they've passed on to their employees. Well, let's talk about the health benefit cost structures, the premium and contributions. What we asked was, please indicate your 2013 monthly medical premium and employee contributions to your most prevalent plan. So that was the plan with the most employees in it. What you can see here is that for the employee only, the total was about $520. And that was split up between the employee and the employer of about $96 to $423 per month. Obviously, for the employee and spouse, you're going to pay a lot more. In this case, around $1,134 for the total. And for the employee, you're going to pay about $378, and the employer about $755. You can also see rates for the employee plus child. You can see employee plus 1. You can also see the employee plus 2, and then a family. I'll talk about premium and contributions of the health benefit plan costs. What we asked to do is to indicate your 2013 total monthly premium and contributions for your most prevalent plan for retirees. Well, retirees are expensive. I mean, for retiree only, less than 65, you've got about $679 in total. That's split up between the employee and the employer, about $460 and about $219 on the average. When you look at employee and spouse less than 65, you've got $1,300 as the cost, and you look at the contributions of being about $960 for the employee and about $397. Once you get over 65 in the retired employee basis, you're looking at a total really of about $400 a total, which is split between the employee and the employer, about $312, and the employer spending about $152. 90% of the organizations that were in the survey do not vary employee contributions based upon either the availability of the coverage under the spouse's plan or the rates that are based upon some sort of salary level. So by and large, what we do in most cases is that we charge employees the same types of premiums, regardless of whether the spouse has the ability to gather coverage under another employee or not. This is an area where a lot of organizations are testing design alternatives, really, frankly. Well, subsidies and PPACA types of plans, what's going to happen, what type of funding changes, PPACA Act. The fact is only about 21% of you are in the position of, I don't know what we're going to do. I would think that those people are, those organizations are the ones that are pondering and asking what is it that we need to do. I'm sure that in fact the 79% of the population are pondering also what we're going to do, but right now they really don't plan to change any of the contributions or any of the schedules, and they plan to keep those intact.